Okay, very good morning, everyone. Thank you for coming this morning. Uh, so today is the first of a series of talks that we are going to have as part of our engagement with our alumni as well as industry partners. And on the uh, unique day today, on 4th of January 2025, I am privileged to actually welcome Dr. Vemal Raj, who is our proud alumni of PIDC. He graduated in 2017 from PIDC, went on to pursue his government service, and then went on to the private sector. And I'm very happy to tell you that he has, along with his friends and colleagues, established the Sentosa group and has taken it forward. He's one of the directors of the Klinik Sentosa group, and PIDC has a strong collaboration with Sentosa group, where we work for clinical attachment, where students go and do some observation over there, as well as we've done some CSR activities along with them. So allow me to first of all give you a little brief of what we are going to do as part of these college open days, college preview open days. So this is an opportunity for all of us to come on weekends, certain weekends, where we actually get to hear from people who have made it in life and inspire all of us, inspire you, inspire us, as well as future students who are interested to pursue dentistry or any other program. This part of the open days is done in collaboration with the with our affiliate university partner, which is Masa University, and this program is also going live on social media on Facebook. So please like and share so that more people get to know about this. Okay, so yeah. So first of all, a very happy New Year, and thank you for coming this morning. So Dr. Vemal completed his Bachelor of Dental Surgery as part of the twinning program with PIDC in 2017. He went on to do his government service with from 2018 onwards, and from 2019 onwards, he has been in private practice. He is one of the directors of Klinik Pergigian Sentosa group and manages the Kulim branch. And I've known Dr. Vemal as a student, as a colleague now, and I can tell you he was, during his college days, he was very energetic, very forthcoming, and a person who used to take initiative. And I remember distinctly that he was one of the sports coordinators. So it's my pleasure and privilege to welcome Dr. Vemal back to PIDC today to deliver his talk on dentistry and entrepreneurship. Ladies and gentlemen, please put your hands together.
A very good morning to everyone and Happy New Year 2025. So before I start my talk, I would like to uh, thank Dr. Ajay and Dr. Kalyan for giving me a chance to speak in front of my fellow juniors here in the college where I studied, did my 5 years BDS program. So my topic today is going to be about dentistry and entrepreneurship. Means that um, what can you expect once you have completed your dentistry, and what are the options there for you to work as, whether you want to work in government or you want to work in private or you want to open your own practice. So I'll be elaborating on that everything in detail later. So a brief introduction about me. So I've graduated from PIDC in the year 2017. Then once completed, I've applied for my MDC and everything and started my government service in early 2018 in Klinik Pergigian, Kota Sarang Semut. It is somewhere near Alostar. It's under the district of Kota Star. It's quite a rural area. You have nothing much there, just a clinic a government clinic, Klinik Kesihatan and Klinik Pergigian, and a few shop lots, few houses. Maybe there's a TF Mart. So that's about it. So meanwhile, in my 2 years, I used to do some locums during my off days, and um, I did my hospital attachment also in Hospital Sultanah Baya in Alusta, where I was attached in the oral surgery department for 1 month and also in the pediatric department for 1 month. So if you ask me whether this 1 month is actually sufficient for you to learn a lot, I would say no lah. But even in this 2 months period, still learn quite a number of things when it comes to doing surgery, accident, trauma cases that you see in hospital and everything, which was a little helpful for me when I started my own private practice. So then at the end of 2019, I have decided to quit the government service and open my private practice in my own hometown, which is in Kulim. And later on, as the years goes on, I've collaborated with two of my colleagues to open a few dental clinics around Kedah, Penang, and also the northern areas of Perak. So, you all might be asking me why did I quit government to join into private practice? So first of all, the clinic I was working, it's not a busy clinic. So maybe you might be seeing around 20 to 30 patients per day, which is actually not that much for a government clinic, where in certain busy clinics, you might be seeing up to 50 to even 100 patients per day. But there you might be having more offices. I think in my clinic when I was working we had like 4 or 5 offices, dental offices. So maximum per day, you'll see like 10 to 15 patients. And the facilities there are not as up to what we do here, what we learn here. Like when it comes to doing your root canals, crown preparations, minor oral surgeries and all. So very limited instruments, and sometimes even you want to take an X-ray is a bit difficult because most of the time the X-rays are not like properly evaluated and for us to take an X-ray. So the one more thing is I was a contract officer. So I think like I was the 4th batch under the contract. So before that, everyone is like, once you join in your government, then you are considered as a permanent staff, permanent doctor. So I'm one of the earlier batch where they just recently introduced with the contract. So usually you have to complete a compulsory 1-year service if you want to quit your government service and open up a private practice. But you have a contract until 3 years where you can choose to complete, and then based on your performance and everything, they will evaluate you whether you are absorbed as a permanent doctor or not. Actually, when talking about how they evaluate you when taking you into as a permanent doctor is not actually just your handwork or how you do patients, how you treat patients. You might be giving the best treatment for the patients in your clinic, but that's not the only criteria they see. So they also see like how you interact with the senior doctors, the staffs, and then your You also have to be active in your extracurricular things like government. They have lots of these kind of like CSR programs, like some oral health talk where you have to give for the uh, kids in your schools, government schools, primary schools, secondary schools. So all these schools you have to give your talk, and you have to be quite active in extracurricular things other than treating patients, for you to be for them to accept you as a, permanent dentist in government. Um, I did actually all of this also, but when I was thinking about uh, the treatment options which is available in my clinic, where I've only been doing like scaling, filling, extractions, and dentures, so there's not much scope for me to grow. But if you are really patient and you really like to wait for your opportunity, um, so if you are interested in any of these specialization like oral surgery, pediatric, um, restorative specialist, periodontal specialist, orthodontics, any of this field, if you are interested, you can actually stay in government, complete your exams, like your MFDS and all, and just wait for your chance to get absorbed in one of these specialization and continue your studies for like 4 years, and you're back to work in government as a specialist. But that can take some time, or you can choose to, uh, if you think that there's not much scope for you there in government, you can consider quitting and either you join a private practice to work as an associate, or you can open your own practice. So the benefit of opening up your own practice is actually you have flexible working hours. So meaning that, okay, you have something to do or you're going for a holiday, you are a little flexible to take your off days and plan your holidays earlier. But opening up your own practice means the whole clinic is under your responsibility. So meaning that any issues in the clinic or the entire clinic you have to monitor. Even during your off days, there are days that where you'll get called from a clinic, where you need to do some troubleshooting via phone and stuff. So studying 5 years in PIDC, I would say compared to studying as a medical doctor, it's a little bit more challenging because yes, as if you're studying for medicine, you have lots and lots of books to study, lots of topics. But I think even as a dentist, it's not much lesser compared to medicine. I would say like you still have to study a lot. But the thing is, you will be treating patients. So it means that from 9 to 5, you are treating patients, and then back you have to go back to study. Whereas as medical, yes, you see patients, maybe you'll be clerking patients, but most of the time when you are doing your undergrad, you won't be treating any patient as a medical doctor. So that is the difference, and it's more challenging to study dentistry compared to medicine. But as a dental student, you always have the guidance of the lecturer. So if anything goes wrong, or if the treatment you have provided is not satisfactory, so the lecturer will guide you or to change your treatment plan or to change your treatment. So, but once you have already graduated, you are on your own. So whatever treatment option, treatment plan, you have to tell the patient and you have to make the decision on the spot. But when it comes to government, you maybe a bit of leeway because you might have like lots of senior officers to guide you and all. But in private practice, some of the clinics where you will be alone. So you'll be the sole only doctor working there with with only staff there, DSAs. So certain things can be when it gets tough. So you need to think some way to get uh, get the patient treated properly. Okay, so my decision was to quit the government service. As I said before, that I don't feel there's much of a scope there to for the treatment I would like to provide for my patient. So I was thinking about uh, quitting and setting up my own private practice with help of my fellow colleagues. So these are the challenges I used to face before setting up my clinic. So first is a good financial support. You have sufficient funds, which is not like I have like lots of cash. I've saved that much of money from my government service, and I can pump all my money into opening up the clinic. Because at least the basic setup will cost roughly around 200,000 to 300,000. So what do you do if you don't have that much of cash? So either you take a loan, and they right now, like lots of companies, they are providing leasing. So they say if you want to purchase dental chairs or autoclave, um, X-rays like CBCTs, OPGs, these companies give you leasing with I would say fairly not very high interest, like maybe I would say like 3 plus 3.5 like that. So you just need to pay like 20 to 25% down payment, and then you pay like monthly for a period of 4 or 5 years. So lots of responsibility and lots of loans that we took. I took leasings and all for me to start opening up my own private practice. So the next is location. So once you've already decided that you want to start a private practice, the most important thing is you have to set up your clinic in a strategic place where you have a good patient pool. So the first main thing is it should be somewhere like in a main road where the cars passing by and you can see, the patients can see. It's not like somewhere the shop lots which are a little inner where is not passable by patient, like I mean customers when they are driving or they are walking through, uh, they are not having much visibility. Yes, of course you can promote it through your social media, through Facebook and Instagram. There's lots of social media influence now where you can promote your clinic. But one of the best way is setting up a clinic where majority of people can actually see where your clinic is. So that is one of the main point. And next is you also have to see the population around that area and what kind of population are they. Like, are they more like retirees or people who are working? What kind of treatment they actually spend on? Their spending capacity, all these things we have to evaluate also. So when you open up a practice, maybe somewhere like a small town, so maybe like big treatments like implants or bridge, auto, all these things. might not be that much. So mostly it'll be like scaling, filling, extractions, maybe dentures, maybe one unit crown, maybe the root canals. Also, uh, not much. So the second most important thing is the location also. So where you are setting up your clinic. So with limited funds, uh, so how do you set up your clinic with your limited funds? That is also a challenge because you cannot be setting up your clinic so luxuriously with expensive dental chairs, expensive uh, uh, information system, and X-rays all in one shot. So for my clinic, what I did is first we set up with two dental chairs, intraoral, periapical X-ray, and autoclave. So that's about it. And renovation. So basically, we start with around 2 to 300,000 somewhere there, and then slowly we build up from there. And then the most important thing is the documentation, which is quite a tedious thing to do because you have to be very accurate with the plan you are submitting to the documentations. So, like for your each surgery room, okay, how much is the measurement should be? So the government have a standard or actually a minimal uh, recommendation of how big your surgery room should be. I think if I'm not mistaken, it's around three times three, something like that. So um, it should be at least that measurement. So even if like few millimeters less than that, that could be a problem. So when the contractors are building up, setting up your clinic, so you have to always keep an eye on them whether they are doing a proper job or not. Because once everything is already done, and then the inspection they came to check, and there's actually the measurement is not up to the standard, then it's a big headache where you have to break it up and you have to adjust the whole thing. So which includes excessive cost also. So in the beginning, since I'm also new to opening up the private practice, I actually hired an agent to help me settle all these documents. But once already know how to do, then the following clinics all we did on our own. And then the rolling capitals means that once you've already set up the clinic, we can't expect actually to have like 15-20 patients a day where you can make immediate profit within the first month. So you need to have a rolling capital every month to cover up your expenses. Maybe it depends on how much your clinic expenses are, how much salary you're paying for the staff, and then for the bills, for the leasing, you are taking the loans and everything. So maybe depends on the expenses, maybe around 20,000, 30,000. So you have to have a rolling capital, not just only for 1 month. I would say like at least 3 months to 6 months, depends on the flow of patient for the first month. So this is my surgery room. So this is when we just started. Okay, so this is my first surgery room, and that's the second one. So it's a basic dental chair, which this is currently now is already 6 years old. So with the intraoral camera there. So other than that, I think it's just a basic dental chair like how you used to see back in our college. It's nothing so special about this chair. So just a basic one. Okay. So and then this is my sterilization room where just with one autoclave and water distiller and just a small fridge to keep all the materials to prevent it from getting spoiled. So certain materials some restoration materials and all we have to keep in the fridge. Okay, so once we have already opened up the private practice, so what are the challenges I was facing during the private, after opening up the private practice? The main thing was staff management. Okay, so when we started with my private practice, we hired like 3 full-time staff and 1 part-time staff. So every time we have to manage their leave. When they are on leave, then we have to find replacement. Sometimes they'll be on MC, and then you have to depend, and you have to call back the staff on leave to come to work. So all these things that the first few months was a little bit challenging because I'm still new to this. So I took some time to actually learn to manage the staff, and then training the staff as well. So maybe we will be training the staff for the 3 months, 4 months. Then they actually already picking up with the work, and then suddenly they say that they want to resign, and then we have to hire a new staff, and then we have to train them all from scratch. So that can be a little challenging also, because once you've already get used with the staff you are working, they know like what we actually need. Okay, once we are doing the treatment, they should come and give you the instruments, the material. So for us to train the new staff back from scratch can be a little bit challenging. So, but right now we have in Kulim branch, we have like around 7 staff and 1 HR and 1 admin staff. So altogether around 9 staff. So compared to 3 full-time staff when I had during my first year. So it's quite a growth, I would say. And then next is the indent for material, instruments, and medications. So it's quite important for us to actually check the expiry date, when the materials and medication are getting expired, and how much you need to order based on the patient load. So everything you have to have a rough idea of how much you need to order from the suppliers. And then you have to also have to see the cost. So you need to try to compare the prices between different suppliers, and also the quality of the material. Doesn't mean that you have to order from them because it's cheap. So you also have to know that the material is actually is a good one for us to use on patients. So, and also instruments. So instruments also we need to always check whether the instruments are in good condition, and whether it's already faulty and we have to replace a new one. So the next is patient management. Like I've explained just now. So once we are in private practice, so patients are coming to actually pay quite a, not like how they pay in government. So pay quite an amount for them to get treated, and they actually expect a very good and most of the time painless treatment. So it is our job and our responsibility to actually give a very good painless treatment for the patients. So like when it comes to the treatment options, see, when I just graduated from here, and after working 2 years in government and started my practice, my treatment option is not that many. So once I've started my private practice, I tend to learn a lot more treatment options, like you can do like an FRC, if you have heard of FRCs, like fiber reinforced composites. So these are the treatments that actually I would say it's not an ideal long-lasting treatment options, but definitely in some cases you have to do what the patient wants. So patient wants something fixed, and they don't want to pay that much, like for a crown, for a bridge or implant. So this is something that we can temporarily do. Maybe in the future, if they are planning to go for a crown or bridge or implant, then you can take it out and proceed for that option. And also, through the years, I've learned more about all these periodontal surgeries, implants, um, um, treatments that we don't usually do that much in dental schools, where we enter lots of courses and stuff to improve ourselves to provide the best treatment for the patients. So the next is management of the assets in clinic. So it is quite important because once you open your own practice, everything is under your responsibility. When it comes to dental chair, when it comes to autoclave, when it comes to the compressor for the dental chairs, even the aircon. So everything you need to manage. So for now, maybe you might not have that much of an information when it comes to if there's any issues with the dental chairs or compressors. Even as an associate, you don't need to be focused that much on it. Unless you are working solely in a clinic, then yes, your boss might ask you to know some of the things related to the issues with all these assets. So just say from your dental chair, there's no water coming, or there's no air pressure is coming, the air pressure is low, or there's air leaking out from your compressor. So all these things you have to troubleshoot and see if you can troubleshoot it, or you need to call the supplier to come and check on it. So when I started my own practice, the first 1 or 2 years, uh, it's a little challenging for me to get to know all these things, because these things we don't really study in dentistry. How to manage a dental chair or compressor or autoclave, all these things. Yes, we may be studying a brief thing about how autoclave works and all, but we don't go too much in depth about how to troubleshoot it and all. So um, after like getting to know uh, the autoclave machines and the compressors and the dental chairs, so roughly after 2 or 3 years, then kind of know how to troubleshoot it. So the less time we need to call the suppliers. Actually, because the suppliers not always they are available. Sometimes they are busy with their work in other place and all. So suddenly something is not going well with the chair. So it's good that if you can troubleshoot it and get it start working back to normal. Because if you can't troubleshoot it, then you can't use the chair and you can't treat the patients. So that's actually affects your income, daily income for your clinic. So all these you have to keep in mind. So usually that's why we have like 2 dental chairs in our practice. So just in case there's any issues with one of the dental chair, so we will use the other dental chair. Meanwhile, the supplier come and check on it. And then the next is attracting patients to clinic. So right now we have, with the help of social media, Facebook, Instagram, TikTok, so there's a lot and lot of ways for us to promote the clinic to the public, for them to come and get their teeth checked, or if they have any issues with their teeth, to come and get checked. And some clinic right now, they are actually giving like promotions for certain treatment. So even though in some cases there are restrictions from the ministry to actually not promote the prices of the treatment cost. So we don't actually promote the prices for our treatment, but in some cases, yes, like if whitening and all. So maybe you can just do some promotion to attract more people, because whitening is something like it's more of a cosmetic treatment. So maybe that kind of treatment. Some clinic they just give promotion for braces, for implant, crown, bridge. So actually you have, if you start your own practice, you have many ways. Promotion is actually is a big portion where you can do lots and lots of things to promote your clinic. So you can do ads, you can yeah, like I said, promote the prizes. You can come up with flyers, brochures, and then some competitions. CSR is one of the way to promote your clinic also. So lots of options for us to attract patients in clinic. So when starting the clinic, so most of the responsibilities is done by the doctor. But once the clinic is established, so right now we have a person separately to promote our clinic. So the person is actually she managed the social medias and come up with new ideas in how to promote our clinic to the patients. So after 6 months, so we start somewhere around October 2019. So it was going very well. Then comes COVID. So I think if I remember, the date was 18 March 2020, where we had the lockdown. So that was the day that we actually had zero patients. Previously, we never had zero patients. So that was the first day we have like no patients. And for the next 2 weeks, some days we close the clinic, some days we open, because since we are one of the essential service, they allowed us to open. So we open like half day like that, but still the patient pool is very, very bad, because patients are like so scared to come out from their own house. So maybe you might get like one patient or two patients per day. So it affected our business, our income quite a lot for the first few months. So maybe after 2 or 3 months, the patient flow is start coming back slowly. But we are still like not allowed to use aerosol producing treatments. I think even in government, they was not allowing for the first maybe 1 or 2 months, if I'm not mistaken. So we had to follow that also. And then slowly they start allowing, but you need to have like certain measures, like some, you need to install some extra filters in your clinic. So after a few months, it started to get back stable again. So only after that, we started improvising our clinic a lot. So these are the improvisation that we have done in the last 5 years. So we we have installed OPG and CBCT machine, since we have lots of implant cases also, and also patients who wants to do ortho treatment but have impacted canines, where you have to go for a major surgery to remove the impacted canines or premolars, which affects the tooth movement. So all these we require a CBCT to evaluate whether it is suitable to be done in dental clinic or we have to refer to the hospital. So it's quite a helpful tool for us. And also we have invested on microscope, dental microscope, for us to do mostly all the root canal treatments. So basically molar, premolar cases, I'm using dental microscope to do all my root canals, and also some complicated cases with like open apex, anteriors, where you have to place like certain like MTAs and all as your obturation material. And then we have installed 2 more dental chairs and hired 2 more associates in Kulim branch. So right now we have 4 dental chairs in Kulim branch alone, and 3 doctors, including me. And recently we have also installed intraoral scanner. So right now, for all crown, bridge, and even dentures, right now we are coming up with 3D printed dentures and all. So I'll explain to you later about it. So we are using intraoral scanner to actually uh, proceed with all the crown, bridge, and dentures. So these are our new surgery room. So this is the 3rd surgery and the 4th surgery rooms right now. Still the basic chair with the intraoral camera. So this is the dental microscope we have in our clinic, thing from Coxo brand. It's not the expensive one like Zeiss and yeah, I can't remember. There's another name of microscope which is quite expensive also. So this is all we are taking under leasing. So we pay monthly. It's not like one shot we are paying. So we still have loans to settle for all these uh, materials and all these assets. And this is our CBCT machine. This is our X-ray room. Actually, we have on the right we have the intraoral X-ray, and on the left is our CBCT and also OPG machine. So right now for our IOP is all digitalized. So means we are using the phosphoplate. So back then in PIDC we used to have the film where you put in the developer and fixer, right? So no need to do that anymore. So you just shoot the X-ray, take it and place in the machine. Then within few seconds the image will be coming out in your computer. So these are the recent advancements in the X-rays. So right now we are having almost 9 branches of clinic. So we started with Klinik Pergigian, Sentosa, Kulim. And then in 2021, we have expanded to Klinik Pergigian, Sentosa, Alusta, Kepala Batas, and Kuala Ketil. And 2022, it was Kuala Kangsar. And 2023 was Lunas Padang Serai. And just recently in 2024, you've opened in Sungai Kok. So most of these clinics are within the vicinity of Kedah, Kulim Kedah. And there's the furthest one is in Kuala Kangsar and Alusta. So next, when we start to have lots of crown, bridge, and also denture cases from all the clinics. So we are paying quite a bit of the crown and lab crown and denture lab fees to the outside lab. So we are thinking about, okay, why not we set up our own dental lab so that we can also take cases from outside and also reduce our cost fee for the crown and denture cases. Yes, of course, opening up a dental lab, you have to invest more money. It's like almost setting up a new clinic like that. But over the long run, you tend to save money from your lab fees. So maybe from all the clinics, you are getting maybe roughly around, you have to spend around 10,000 lab fees. So that almost in a year, you are spending almost 100K lab fees. So in long term, this helps to reduce the cost for lab fees. So we have set up this lab in 2023, early 2023. So at first we just started doing dentures alone. Then right now we have hired a dental technician who is well versed in doing digital crowns and also 3D printed dentures. So we have invested more equipment in our lab. So this is our desktop scanner. So this is the place where, this is the place where you place your cast, your upper and lower cast, and then the scanner will help you to scan the cast, and the image will be coming onto the computer. So later I'll just show you a short video on how actually a crown is scanned and milled and fabricated. Okay, this is our dry and wet milling machine, where once the technician is already designed the crown, so he will send the details via Bluetooth to this machine, and the machine will start milling the crown. And this is the sintering furnace where you place the crown here before you're doing the final adjustment and everything. So this is our 3D printer. So right now, there are more and more clinics are coming up with 3D printers where once you take the impression, you scan the cast and you design the dentures in your software and then send the data to this 3D printer, and this 3D printer will actually print you the denture. So right now, we can actually, with the help of 3D printer, we actually can issue a complete denture, upper, lower, within few days, including bite, trial, and issue the denture. So because for us to do a teeth setting, I think you all be taking one whole day, right, for complete denture, upper and lower. I think even a very trained, experienced technician, he said that he need around at least 2 to 3 hours to do a complete denture teeth setting. But in our software, we design the fastest we can design uh, a denture is 15 minutes. But of course, with some extra detailing and all, we can take up to 1 hour. But yeah, it's that fast that you can actually do your setting and everything within like 30 minutes. So this is the wash and cure machine where after we have processed the denture, so we place it in this to clean it before doing our final polishing. So yeah, these are some of my cases that I would like to show you. Sure, the picture is a bit less clear here. Okay, so with my advances in all my with the help of microscope and more uh, new materials and instruments in my clinic. So right now I can do a bit more of complicated cases, not only the basic root canal cases that we used to do in during our undergraduate time. So these are some of my open apex cases that I actually did a MTA obturation. So these are some of my molar RCTs. In some, with the help of microscope, definitely you are highly likely to find an MB2 canal, which is very difficult to find with your naked eye. So these are some of my crown and bridge cases where take impression and we send to our lab, and the lab have fabricated us the bridge, and that's the crown. So these are some of my cases with multiple caries teeth and restored with crown. So discolored teeth with crown. So these all done through digital scanning and 3D zirconia crowns. These are one of my implant cases that I have started recently. Think from last year, started placing implant after going courses. So these are all of my implant cases that so straightforward cases which has good bone, good height, good thickness, where you don't need any bone graft. So just place an implant and with the healing abutment. And after 3 months, you call back the patient to take an impression to do the crown. So I'd like to show you some videos about how we use the intraoral scanner to take the impression, to scan, and also send to the lab to do the uh, to process the crown. This is just for the demonstration purpose where I'm taking intraoral scanning with one of my staff. Okay. So once you already do the preparation, use the intraoral scanner and just scan the whole upper and lower arch. So this scan actually just takes about upper and lower, it just takes like 5 to 10 minutes. Depends on your expertise also, how fast you are scanning. So definitely when you start scanning, it takes some time, but once you get the flow of it, within 5 to 10 minutes, you can actually scan the upper and lower arch. So the advantage of this is when compared to your putty light body impression, there's less chance of like any voids or defect, where once you send to the lab, then the lab will say that, okay, there's a bit of a defect in the cast. Then you need to call back the patient to take a new impression. All these things we can avoid by this intraoral scan. So right now, even with the complete dentures, we are just in our preliminary stage where we actually using the intraoral scanner to scan the dentures, where even without bottom molding and secondary impression, you can still get a very good retention. But provided that you need to have a very good scan data for the upper and lower arch.